Hi, I'm Dr. Tener here at the Goldberg Tener Clinic, where we focus on reversing chronic disease. I'd like to introduce an interview with one of our patients. Her name is Kate. She came to see us back in 2020 originally. This is now 4 years ago. It is now November of 2024. Kate, at that time, flew in to see us from Pennsylvania. She had an aggressive form of rheumatoid arthritis. She was really in bad shape at that time. And after working diligently with her for about 9 to 12 months, Kate was able to regain her health, reverse her condition, get off all drugs, and it really was a remarkable turnaround. We actually did a video interview with her back in 2020 in which she discussed the success that she achieved. But we've done another interview with her now, 4 years later, in which she not only discusses the success she had previously, but the fact that she has maintained excellent health since that time over the course of the last 4 years. Dr. Goldberg and I really pride ourselves not only in helping patients get well, but teaching them what to do to be able to stay well for the future, to really turn healthcare into self-care. And Kate's case is a really excellent example of that. So without further ado, here's the interview with Kate now in November of 2024, 4 years after her initial visit.
So
Yeah.
tell us the scenario in your case. What's been going on with you over the past 4 years? You got well from rheumatoid arthritis, working with us, and what has happened since then?
Yeah. So quick recap, I pretty much my health fell apart as the world fell apart with COVID in the spring of 2020. I mean, I was sick before for a few years before, but I was really desperate. And so when I went to visit you in Atlanta, June or July 2020, I pretty much, got all the tests done and I started the treatment. I did everything that you told me to do, literally, like every box was checked. And I think I was off my medications in 3 to 4 months for my RA medications. And I think that within, I want to say 6 to 9 months, I was pretty much free of all flares. Long story short, no evidence of disease. My rheumatologist actually spent a record hour and 15 minutes with me for our last appointment. It was about 2 years after, maybe a year and a half after I visited you. And he was just very confused, and I felt bad for him. He's an older gentleman, and he was just sincerely confused, and he kept saying, well, maybe you're in a spontaneous remission. And I'm like, there's nothing spontaneous about it. I had to work super hard.
I remember on the video that we shot a few years ago, you had, we just watched it actually to kind of fill ourselves in again about what had
Yep.
gone on back then. And you had mentioned that your rheumatologist said that you were going to be on these drugs for life.
Yes. And that was my verdict, so my markers have gone down. About 3 years ago, they were pretty much back to normal. I just got retested. They're normal. There is no evidence of disease in my body. There is no evidence of flare. Even I pretty much, I don't have any restrictions. Now I can go to the gym almost every day. I walk probably 6 to 8 miles a day. There's no way I could have done that in the summer of 2020.
So since the last interview we had of you, in which you were very happy, you had dramatic improvement in your symptoms, your health had improved a lot. You've actually been able to keep that stable and even had some other improvements since that time.
Yes.
Is that correct?
I was able to, I don't have extra weight any longer. I'm able to be super active. So basically, my RA does not impact a single area of my life. I mean, for all intents and purposes, I don't have it. So,
And your medical doctor, the rheumatologist, he did rerun some of these blood markers on you, and they
yeah,
came negative.
yes.
They were
Even
positive originally, and now they're negative.
Yeah, they were very positive.
Yes.
And they actually kept declining. And even with and again, this is additional details, but as you know, the CCP doesn't really drop significantly. Once it's there, it's there. Even there's no evidence of symptoms. Even my CCP marker has significantly gone down. So it's not, it's not like it's not negative, but it's the number has probably decreased, I don't know, 5-6 times. So, and my RA factor is normal. I mean, I'm really healthy.
Yeah. Well, the body's cells have a turnover of everything except for nervous system cells of about 5 years to get everything replaced. So if
Yeah.
the patient's doing the right thing, they start having good improvement, maybe fairly quickly. But if they continue doing the right thing over the next 3, 4, 5 years, they continue to have more and more improvements as there is that cellular turnover and new cells are created. That sounds
Yeah.
like what's been happening with you.
Yeah. I really love the word that you guys use. Tell me what it is. It's not, is it restore health or there's recreate health?
Yeah.
Yes. That's what I feel happened. I feel like my health was recreated because I was a really unhealthy person. And, I think biggest lesson was not to trust the labels, because when I came to you, I knew my labels and I knew that they're not curable. And I was like, well, this is before coming to you, I thought this is my life. I have no choice. This is my life for the rest of my life. And then when this happened, I'm like, wow, the recreation of health.
Yeah, couldn't have said that better ourselves.
Yeah, very, very well said.
The interesting thing about this too is that these kind of outcomes are really unheard of in rheumatologists' offices. People end up suppressed and on drugs where they just kind of shift you from one drug to the next, indefinitely. People don't actually get well.
Well, that's why her rheumatologist was so confused about it. He's
Surprised.
puzzled.
Yeah. And today I'm in the presence of two people who both had rheumatoid arthritis and now are well and have been well for a long time. So two examples there, in addition to the many others on our website, to actually illustrate what's possible. It's not just a fluke. People get well and are able to stay well, as evidenced by your case, and also this guy right here who also had the same condition.
And that's what inspired me to begin with. When I was looking at your clinic, I was looking at Dr. Goldberg's and his pictures and his like before and after. Like, well, if one person could do it, I could be the second person at least, if not more. There's nobody else. So.
And yet there were different factors involved in your case than mine. Every patient is very different from the next. Everybody is
Yeah.
different.
And
But
that's why when I actually had a lot of people even like reach out to me randomly online because I was in a couple of Facebook groups. And that's what I told them. I said, listen, the guy who referred me to Goldberg Tener Clinic, he is also local from Pennsylvania. And even with me and him talking, like his regimen even was different from what mine was, because his conditions were different. His factors were different. So when people ask me, well, just give me your plan, I'm like, sure, but it's not going to work. It might not work for you because you need to understand the root causes first and then pick out the treatment that's going to work for you. So otherwise it's a letdown, right? And then disappointment. And it's really hard to be disappointed with your health if it's such a big detrimental factor.
yeah, we can't just pull out a file and say, here's our treatment plan for rheumatoid arthritis or psoriatic arthritis or ulcerative colitis. It's always has to be very individualized to the patient's genetics, to the patient's lifestyle, to all the many factors that go into making up a person.
Yeah, and I think there are protocols online, you can find information online. I felt that it was easier for me to have an individualized approach because, a lot of time can pass until you find out by trial and error what's going to work for you, right? Using those resources that are available. So I'm really happy. I mean, my healing was super expedited, being healthy.
We're both delighted to hear that even after 4 years, you're still doing so well and you're keeping the faith and keeping the perseverance. And I would predict that she will continue to do well on to the future.
Don't see any reason why not, as long as she continues to do the right things.
I would have to agree with you.
Okay, thank you very much for joining us.
Thank you.
Yeah, my pleasure. Good to see you both.
You too.
Mhm.